let's see a few more final remarks regarding demonstration of freedom. We mentioned repeatedly that the sensitivity of a diagnostic test impacts the sample size. The lower the sensitivity, the larger the sample size. Therefore, sensitivity is included in the calculation of sample size. But we never talked about the impact produced by the specificity of the diagnostic test. So, first, let's remember the definition of specificity of a test. It's the probability that a sample is classified as negative by a test, given that the event is not present. The less specific a test, the greater the number of false positive results, and vice versa. So if we analyze 1,000 samples free of the event with a 98% specific test, we may expect 980 true negative results and 20 false positive results. Remember that these results are based on a probability. Therefore, they are the most probable results, but they may differ. So specificity is not included in the calculation of sample size. However, it plays an important role in the results, so it has to be taken into consideration. When planning a sampling to demonstrate freedom, it's crucial to estimate the expected number of false positive results. So in this country, a sampling was conducted, and the idea here was to demonstrate freedom of disease. And the sample size was 1,000. The specificity of the test was 99.8%. Therefore, two false positive samples were expected. That's what it means. The results were all negative, except one. So the question is it a true or a false result? That one you see. Is it a true or a false positive result? There is no way of answering this question from a theoretical perspective. So before starting the sampling, a working protocol must be defined, describing the procedures to follow when positive results are identified. So in general, it's necessary to go back to the site, look for the clinical signs and other factors that could explain the result that you have. And more samples have to be taken in order to confirm or to reject that sort of result. Let's see now the effect that some factors may have in probability of a territory being free of disease. So to illustrate the impact of elapsed time since last survey, we have two scenarios. So they are shown here as countries A and B. So they conducted similar surveys and both arrived to the same conclusion. The conclusion is that at 95% confidence that the prevalence is lower than 1 per 1,000 animals. So country A did the survey 12 years ago, and country B did the survey last month. So which country do you think has the lower probability of freedom from disease? So the obvious response will be that country A. But let's see more details about these countries. So country A is an island in the middle of the Pacific Ocean, and their nearest neighbor is 1,000 kilometers away. And it has this country has a very effective control system in their ports and their airports. It could also be a compartment with effective biosecurity measures. On the other hand, country B is placed in the middle of the African continent. It shares borders with 6 other countries, and these other countries are all endemic with the disease of interest, and their borders are very permeable. So, do you still think that the probability of freedom is lower in country A or than in B? In this case, the conclusion is that the probability of being free of disease decreases over time, and it's also very affected by the risk of reintroduction of animals and it increases when the surveillance is frequent and has a high level of confidence. To reinforce the above, we'll see a series of graphs that illustrate the impact that the level of confidence of the surveillance system, here shown by the green line at the base, and the risk of disease introduction, shown by the red line, have on the probability of remaining free over the time, which is shown by the blue line. The probability at time 0 is 50% because this value represents the initial uncertainty. In this scenario, we have a very weak surveillance with a constant confidence of 20%, and the risk of reintroduction is 0. Note that as time passes, the probability of being free also increases. This situation is more realistic. It could be the island we saw earlier, where the risk of introduction is very low, but not 0. The probability of freedom also increases over time, but to a lesser extent. Then, and here we have a risk of introduction that is variable and greater than 10%. We see that the probability of freedom slightly decreases as time progresses. In the next scenarios, the risk of introduction will remain the same, and we will see the impact of surveillance on the probability of freedom. Here we raise the level of confidence in our surveillance, and we are doing some passive surveillance in slaughterhouses, and we manage some sentinel herds. The level is constant at 40%. Note that the probability of freedom has now a slight tendency to increase. And what would happen if they were stricter with our actions and at the same time carried out active surveillance? Then in this scenario, we increase the level of confidence of our surveillance even more, and we conduct active surveillance every 5 time periods. The effect is an obvious increase in the probability of freedom, which is now around 80%. Then in this last scenario, we carry out the surveys more frequently, every 3 time periods, and the effect is the slight gain in the probability of freedom, which is around 85%. As you can see, the number of possible scenarios is endless. And in this context, we must emphasize that surveillance is useful for demonstrating freedom of a disease, but simultaneously, the risk of its introduction should be reduced through the implementation of risk management measures. And here we finish with this topic, and thank you for your attention.